So normally when folks come talk to me about intrauterine devices, oftentimes they're nervous because they've heard something on the internet or a friend or a family member that has had a negative experience. But I like to let folks know that certainly as a provider, I've put in hundreds of them and the majority of patients really enjoy them. There's 3 different types of IUDs. There's a copper IUD, a Skyla, and also a Mirena. There are some other ones coming out on the market, but those are the 3 primary ones that are available at this time. The difference between those 3 is this. The copper IUD has absolutely no hormones in them, but it can make your periods heavier and more uncomfortable. Then there's a Skyla and a Mirena. Both the Skyla and the Mirena have progesterone in it, but philosophically only trace amounts of progesterone are diffused into the bloodstream from the uterus. The benefit of both the Skyla and the Mirena is it makes your periods lighter and less uncomfortable, if not non-existent, and that's very normal. And that is not harmful that you're not having a period. What the progesterone does is it thins out that lining, so with less lining there's less chemicals to be released at the time of your period, which causes them to be less uncomfortable, and of course that also translates into less bleeding as well. I also like to let people know that we don't necessarily know how they work as a contraceptive, but we don't feel that they're an abortive contraceptive option every month. We think they either, number 1, block the sperm from meeting the egg by changing the cervical mucus, or if there's a super sperm that makes it through, it dies before it meets the egg. And here's some pictures of actually what the different types of IUDs. This is the Skyla and that's the Mirena. The Skyla is just a little bit smaller. I like to use the Skylas for women who've never had a baby before, just because even though it's not that much different of a size, when your uterus has never been stretched, sometimes it objects a little bit to having an IUD in. But everybody usually does quite well with it after a day or 2, and just the little smaller one sometimes tends to work well. So when actually they're placed, what I initially do in the office is you sit down just like you're having a pap smear, shimmy your bottom to the edge of the table. I put the speculum in. A lot of times you have to hold on to the opening of the cervix, because we always have this vision that the uterus is a straight shot and it actually curves. So you want to straighten it out so you can go in as a straight shot, or else it gets a little more challenging. So you hold on to it and pull it down, then you figure out how far it is from the outside of the cervix to the top of the uterus. And then you open up your Mirena device. And then you kind of hold it down and I load it up, and so you can see when it loads up, it just loads up into this kind of the straight line, and then it comes with little like a little measuring stick, if you will. So I know when I measured before, do I go to 6, 7, 8, 9, where do I put it? And then I set it to that. And then what I do is, holding onto the cervix, I've already kind of figured out what it feels like to go in. So then you go in, you go almost to the top, and then kind of pull back a little bit, and when you pull it back, it deploys the device. You can see that little up there, and then you push and it goes up to the uterine fundus, and then you gently keep pulling back, and then you just kind of gently tease it out, and then cut the strings and you're all done. And then when it's time for the IUD to come out, all we do is we hold on to these strings with a grasper and then pull, and it comes out super easy. So that's pretty much it for an IUD.